ticks are small arthropods, which are insects that essentially live in grasses and other places, pretty much across the entire world, but specifically here in the Midwest, where they tend to live in grasses and in trees, because as things pass by it, that's how it attaches. So one of the most important things is that after you've been out doing one of those activities where you're at higher risk of exposure, ideally you should shower within about 2 hours. The reason is that you want to do a full body inspection and wash off any ticks that haven't already attached. So if we can get all the ticks off of us, that's better than having to worry about any diseases that they can carry later. If it's on your clothes, brush it off. If it's on your body and you're within that very short window where it hasn't attached to you, get it off. When you remove a tick, ideally you're going to take a small pickup or tweezers, as we might call it, and you want to use ones with a very, very fine tip on it. And you're going to get down as close to the skin surface as you can, right at where the face and the mouth actually are attached to the skin at. You're going to grasp it firmly and then slowly and gently pull straight up. The next best thing is, as soon as the tick is off, that we cleanse the skin, that we wash the skin really well, good soap and water, maybe some kind of an antiseptic or something, just to clean the skin really well, and then make sure that we observe that for signs of infection that can develop. There are dozens, if not hundreds, of different types of illnesses that ticks can come with. We have 3 major types of ticks in the state of Iowa, 2 of which tend to be the ones that we see the most here in central Iowa. The wood tick, that one typically is slightly larger in size, and it can carry a number of diseases, but it does not carry Lyme disease. The very small ticks are deer ticks, and deer ticks are extremely small, and when they're in their larva stages, or kind of developmental stages, they're almost too small to even see. So it's hard to recognize that they're there until they've attached, and then they start to become engorged. And when we say engorged, they're essentially taking blood out of your bloodstream, and at the same time, ready for it, injecting saliva into your bloodstream. And that saliva is actually what transmits a lot of the diseases like Lyme disease. The good news is, if it's been less than 36 hours, that they do not transmit disease. But once it's been there for more than 36 hours, we need to either monitor it for signs of infections, such as Lyme disease, or in some cases we may even do preventative treatment. So we actually give you an antibiotic to hopefully prevent any of those diseases from actually coming. Specific to Lyme disease, we're looking for the development of a rash. And when I say a rash, it's a very unique rash. It actually is in the shape of a target. So it's a red lesion that might be from where or near where the insect bit you at, and it actually starts to expand a bit over time, and it literally looks like a target. That is the first stages that we see in Lyme disease, and we must treat it before it becomes into a more advanced disease. And Lyme disease can become very serious and even potentially cause permanent injury to people if it is not treated, and certainly the earlier the treatment, the better. Try to limit the exposure by just literally having extra layers of clothes on or being fully covered. So your arms fully covered, your legs fully covered, etc. The other piece is to use a insect repellent. And those insect repellents that are most successful in avoiding things like ticks are actually contain DEET, spelled D-E-E-T. And so you do want to have something that contains DEET in it, and ticks hate it, and they won't get on you. So if you're doing those 2 things in particular, you're far lowering your risk of even developing it, because I want to go out and enjoy Iowa. We have beautiful outside weather this time of year. Being outdoors is one of the best parts of living in Iowa, and I hope that everyone has a wonderful, fun, and safe rest of the summer.